Hello, and welcome to Tech Talk Community Conversations with Dr. Jill Bowen, Commissioner of the City of Philadelphia, Department of Behavioral Health and Intellectual Disability Services. In Tech Talk, we explore the work DBHIDS and our partners do to address the key components of tech, which stands for trauma, equity, and community. So now let's learn about tech. Dr. Bowen?
Thanks, Mark, and hello to all, and welcome to Tech Talk Community Conversations, the video series in which we explore how the work we do at DBHIDS and with our community providers and partners aligns to address trauma, achieve equity, and engage community. Today, I am joined by Katrina Pratt-Roebuck. Katrina is the Senior Director of Systems Integration with the City of Philadelphia Department of Behavioral Health and Intellectual Disability Services, DBHIDS. She has been helping to serve the people of Philadelphia for 4 years. Katrina, why don't you tell us a little about your work here and how it aligns with the priorities of trauma, equity, and community? And I think, Katrina, that you have been with DBHIDS for 4 years, but you have been serving Philadelphians actually for longer than that, haven't you?
I have. So I have been with the City of Philadelphia for 20 years and in social services for 25 years. So very proud of the amount of time I have been able to serve Philadelphians.
That's really beautiful. And I know that the work that you do at Systems Integration is something that you really built and you really incorporated into this department. Why don't you tell us a little bit about the Systems Integration unit that you oversee?
Sure. So let me just start and say thank you for having me, Dr. Bowen. I really feel honored to be the final Tech Talk and Community Conversation guest on this podcast with you as the DBHIDS Commissioner. And so I really also was very honored when you asked me to lead the work under your Vision Tech. And within the Systems Integration Unit, we have striven to really lay out a strategy that is comprehensive, that serves individuals, communities, has place-based activities, and really engages people cross-sector across the city and multiple disciplines. So our systems integration unit has really worked hard to try to integrate all of the work happening across the department, but as well as across the city of Philadelphia.
Fantastic. And I know that you are a leader for the City of Philadelphia in terms of addressing the social determinants of health. Those are the drivers of health and wellness. And maybe if you would take a few minutes to just describe to us what your understanding of what the social determinants are and how they impact tech.
Sure. So I think that most folks, when they think about poverty, they are not typically aligning that with an experience of trauma. And I just want to note that being in poverty is traumatic. Not having your basic needs met is traumatic. And so I am appreciative of our department's approach that is a population health, whole person approach, understanding that people need all of their basic needs met in order to be successful. And so within our social determinants of health work, we have really thought about how we embed resources for people so that it helps them in reaching their behavioral health goals. And what that looks like is a number of things. Folks need to have a stable place to live. Folks need to also have an opportunity to earn income and have stable income. A lot of folks in this city are food insecure, and so we really understand that food security is important. We understand also that folks need transportation, not only to get to health appointments and jobs, which are very important, but also to decrease social isolation so that they can engage with their communities and their families. And lastly, in this age of technology, it is so important that people have access to the internet. So many opportunities folks have to access through the internet. And so I'm really proud that we have taken a comprehensive approach in addressing social determinants for the folks that we serve. And what that looks like is assessing people when they come into our front doors that indicate that they need certain services, and really connecting them to those community-based organizations or to the resources that the department has developed to serve people. And so addressing the social determinants is really an important aspect of someone's long-term recovery and success.
Yeah, you can just imagine how somebody who is working on their behavioral health or their general wellness could succeed if they are homeless. I mean, it's just, if they have housing insecurity or food insecurity, it's such a huge barrier to any real success in terms of one's behavioral health, which is why, from a behavioral health perspective, it's absolutely critical. We even think of it as part of the treatment itself, is to ensure that folks have these social determinants addressed. And there's inequity in terms of folks who experience different social determinant challenges, and that impacts the disparities we see in health and behavioral health care.
Absolutely. And so we know that BIPOC communities are overrepresented in terms of housing security, food insecurity, economic security is a challenge. And so, really calling out and acknowledging these challenges then allows us to create strategies. So it's really important that, and I'm really appreciative of being in this department and under your leadership, is to really call out and challenge what we see happening, because we can't solve issues that we won't confront, right? We can't solve issues or attempt to address issues that we're not willing to look at. So I think that we have taken a brave look at thinking at how we can make sure that we are serving people equitably. And that looks like ensuring that we are helping people in all of the zip codes in Philadelphia. That means that we're looking at if Black and Brown communities are not served equitably as white communities. And that intentionality is something that I really appreciate and is part of the culture here. And I think that that's important as well. The culture here is everyone recognizes that there are health disparities and we want to close those gaps, and we want to give everybody the same opportunity for health and well-being.
Thank you. And the systems integration itself really acknowledges that there isn't just like one lane for this, it's everything. And it has to be integrated and coordinated, both internally within DBHIDS, which has, many divisions and many foci, but also across the city as a whole. And that makes me think about the accelerator grant, and maybe you can say something about that, because that's pretty exciting for DBHIDS to have leadership of that across the city and bringing so many different agencies and communities together around the accelerator work.
Yeah, absolutely. And so just thinking over my 25 years of work, I think that the amount of collaboration and intentionality around collaboration has never been greater. So I am really pleased to see that systems see the interaction, the integration that needs to happen to serve people as best as we can. And so the award that DBHIDS received was the Centers for Disease Control, Social Determinants of Health Accelerator Grant. And so that grant has provided us with an opportunity to create a comprehensive implementation plan to address the social determinants of health for folks that enter into any of our city system doors. And so in that CDC, for short, SDOH Accelerator Grant, we have a leadership team that includes leadership from all of the health and human services agencies across Philadelphia, as well as some of the Office of Children and Families leadership. And we also have other partners like SEPTA and several community-based organizations. And we have folks with lived experience, which is also just really important in understanding if our work will reach the people in the way which they need to be met in order to serve them well. So we have a year-long opportunity to create this comprehensive plan. And we've had focus groups so far that have included people that have had forensic involvement forensic justice involvement. We're also going to interview focus groups that have other types of vulnerabilities that we need to think about when we're rolling out a plan. And so DBHIDS, we have been provided the opportunity to provide leadership around how this plan is implemented. But I want to say that this is a plan that is inclusive, and the leadership team is just, quite frankly, amazing that we have access to. Also, the folks that have lived experience, we have one individual who has intellectual disability, and that has been immensely helpful in thinking about how we roll out services to all of the populations that we serve.
It's really a wonderful opportunity, and it also acknowledges Philadelphia, DBHIDS, you and your team as leaders in this work. And so I'm really pleased to be able to expand the culture that you're speaking about that exists here in DBHIDS beyond, and to bring in the experiences of the community leadership, community-based organizations, people with lived experience, and of course, the different agencies across the city. So looking forward to the planning paper and the implementation plan so that we can see what the next steps would be in terms of really addressing some of these significant barriers to behavioral health and wellness that's so aligned with our efforts to address trauma, achieve equity, and engage community. So I really want to thank you, Katrina, for all the work that you have done to stand up and to engage and to bring people together. There's over 100 stakeholders from every corner of the city that engages around the External Stakeholders Learning Collaborative, and the whole TEC comprehensive plan, which is available at dbhids.org/TEC, TEC, really grew out of the recommendations and conversations that happened in the group that you have spearheaded. So people can check that out to see really the whole range of work that's being done through DBHIDS and the systems integration group around TEC. So with that being said, you mentioned this was my last as commissioner, so I am moving on, and that's for both personal and professional opportunity. I think people know that I have become a grandparent, and part of that is my driver for moving on, but I'm going to work at the state level in Vermont, very much looking forward to bringing some of these ideas even wider, because we know that the approaches that you have been describing really are present across this country and in many, many places where this kind of work would be so, so effective. So thank you for being a leader. Thank you for being a leader at the national level, and for sharing with us and this audience here in Philadelphia about the work that you are doing that's getting national attention and also making a difference here in Philadelphia. Thank you. And Katrina Pratt-Roebuck, TEC champion. Thanks all.
Thank you. Thank you.